Hi, I'm Michael Wong, and I'm currently at Ideal Plastic Surgery. I've been a plastic surgeon for now 33 years. I was CSPS president from 2018 to 2019. I first got interested in plastic surgery after seeing a breast reconstruction. It was a delayed pedicled tram, and taking her abdominal tissue and transferring it to her chest wall and reconstructing a breast mound, I thought that was incredible. I didn't even know that was possible. Clearly, from a technical standpoint and from a creative standpoint, plastic surgery is really challenging and rewarding. The pedicle tram breast reconstruction really showed me that it can be really transformative as well, and didn't appreciate it until I saw that operation. When she came back to the clinic and she came in smiling with makeup, dressed up, and had a whole different demeanor about her. And she was so happy that first thing she did when the surgeon entered the room was that she hugged her plastic surgeon. And I thought that was so meaningful in that plastic surgery can do that. So plastic surgery is a specialty that, as Tagliacozzi once said, we do these things not so much that it might delight the eye, but it can really buoy up the spirit. And in this particular case, that's what I saw. The surgeries we do may not extend the life expectancy of our patients. However, it definitely impacts in a very positive way the quality of life and makes life worth living. And so, I really enjoyed doing breast reconstructions at UC Davis, and I continue to enjoy the reconstructive nature of post-bariatric body contouring. When I was a first-year medical student heading off to my summer vacation, I had the opportunity to come back home to Sacramento and spend some time with a bunch of my father's colleagues in town that covered a variety of different specialties. They included hand surgery, cardiac surgery, allergy, interventional cardiology. And I would have to say that probably among the least favorite specialties, based on my experience at that time, was plastic surgery. Because I didn't fully appreciate what plastic surgery did for our patients. I had simply seen some aesthetic procedures and didn't fully appreciate the impact that it was making on their lives. So I would have to say that experience of seeing that breast reconstruction and the way that impacted that particular patient really opened my eyes up to what plastic surgery really does. And so that is still my most memorable experience in plastic surgery. I certainly never planned on becoming CSPS president, that's for sure. I simply joined the California Society at the urging of my chief at the time, Tom Stevenson, who gave me the advice that I should join organized plastic surgery, and how about looking at the California Society. I had other mentors that came into my life through CSPS. I had John Osborne then invited me to become the auditor of the council, and then he appointed me bylaws chair. So I learned about the society and its inner workings and policy and procedures. Then I became the YPS chair, joined the strategic planning committee. Then I was appointed to the Counselor of the North. And then through connections with our current president, Gordon Lee, we were able to establish a working relationship with the Annals of Plastic Surgery. From there, I think I became treasurer, and then vice president, president-elect, and then president of the society in 2018 to 2019. Really beneficial to start exploring any inklings that you have of areas of interest early and through multiple different lenses. This might include clinical experiences, research opportunities, service, advocacy. And if you're interested in plastic surgery, it might look like something like finding the local plastic surgeon in town. If you happen to have the luxury of a home program, then maybe you start at the academic center. If not, maybe you find a private practitioner that you can shadow. I would just say that I'm extremely grateful for my time in CSPS, for all the friends that I've made, and for all the opportunities that I've had to serve and to lead that it's created for me. I wouldn't be here before you today were it not for them. So without these people who encouraged and supported, mentored me, I wouldn't be the plastic surgeon that I am. So I'm thankful for the CSPS.